Hello everyone. Today I am going to talk about the topic that is disease heterogeneity. So it sounds little complicated, but I will try to explain it in simple terms with examples. So let's get started. So what is the disease heterogeneity is? Let's try to understand it with two examples. So first example is of the apple. So imagine if you buy two apples and you notice that one of them is sweet and crispy, whereas the other one is sour and soft. So both are the same fruit, right? Apple, but they have different taste or experiences. So same fruit but different experiences or taste. That is called the heterogeneity. And since we are talking about the apple, we can say it this is the heterogeneity in the taste of apple, or for the sake of understanding we can say this is uh, apple heterogeneity, right? Apple heterogeneity. So same fruit but different taste. Let's take another example. So imagine you and your friend go to a coffee shop and order cappuccino, and when it arrives you notice that your coffee has lot of foam but your friend coffee has barely any foam. So both are cappuccinos, right? But they are not quite same. So this difference between the things that seems similar is what we mean by heterogeneity. Okay, so by definition disease heterogeneity is if two people or more than two people have the same diagnosis, right? For example, cancer or Alzheimer disease. But the way that disease behaves in their body can be very different. So, same diagnosis, but they may show different symptoms, and that is called as disease heterogeneity. Disease heterogeneity. Okay, so let's look at particular example of the disease. So, for example, cancer disease, and I am taking example of the lung cancer heterogeneity. So within lung cancer, there is a two type of the lung cancer. That is the one is non-small cell lung cancer, that is NSCLC, and other one is the small cell lung cancer, that is SCLC. So both are the lung cancer, but they are different. And even within NSCLC, there are two subtypes. So let's look at this table. So it's showing the type, that is the lung cancer, right? And subtype is adenocarcinoma and squamous cell carcinoma. And these subtypes are the part of NSCLC, that is non-small cell lung cancer. So both are the lung cancer, but if you look at the symptoms, right, they are different. So for the adenocarcinoma, the patient may show persistent cough, chest pain, fatigue, and often occurs in non-smokers. But if you look at the squamous cell carcinoma, the patient may show cough with blood, difficulty in swallowing, and recurrent lung infection. So the main point is that adenocarcinoma and squamous cell carcinoma both are the lung cancer, but they show different symptoms in the patient, and that is what we call it as lung cancer heterogeneity. Okay, so let's move to another example, that is Alzheimer disease heterogeneity. So, as we know that Alzheimer disease is characterized by memory loss and decline in cognitive ability, decline in cognitive ability. So these are the like general symptom of the Alzheimer disease. So Alzheimer disease also have different subtypes like typical Alzheimer disease, posterior cortical atrophy, rapidly progressive variant. And these subtypes are categorized based on the symptoms they show up in the patient. For example, typical Alzheimer disease, they show memory loss, difficulty with daily tasks, and disorientation. But if you look at the posterior cortical atrophy, so symptoms include that is difficulty with vision related tasks like reading, judging distances. Whereas for the rapidly progressive variant, symptom includes severe cognitive decline over few months. So that is important. So over few months instead of years. So this disease progress very fast in the patient. So again here the main point is all these subtype of Alzheimer disease, that is typical Alzheimer's, posterior cortical atrophy, rapidly progressive variant, all these Alzheimer disease they differ in these symptoms, and that is what we call it as Alzheimer disease heterogeneity. And understanding these differences in the symptoms of the patient is key for better diagnosis and treatments, because one treatment which could be effective for one patient of Alzheimer or cancer may not be effective or even safe for another patient. So, what is the take home message of this short video? First thing, we can appreciate what is the disease heterogeneity, right? So it refers to how the same disease can behave differently in different individuals. Example include cancer or Alzheimer disease heterogeneity. And why it matters? Because understanding these differences helps researchers to develop more targeted and personalized treatments, which could improve the patient's outcome. Okay, finally, I will leave you with these review questions, that is, why is understanding disease heterogeneity important for developing effective treatments? So you can think of about how disease like cancer and Alzheimer's can vary in progression, symptoms, and response to therapies among individuals, and how these change in symptoms may affect the outcome of the treatment. So that's it for this video. Thanks for watching and see you in the next video.